Good morning, everyone. Thank you to the BioCanRx Committee for the honor of giving this year's Imagine Lecture. And today I hope to provide you with an overview of what has been a crazy year for me and what it feels like a whirlwind of hope and privilege for myself over the past year that has brought me and my research closer to patients, especially cancer patients in Manitoba, and how we have worked together as co-pilots, and you'll hear more about this in the coming slides, in navigating the complexities of cancer care and cancer research. Before I begin, I wanted to acknowledge that we are gathered today in the unceded lands of peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations, and also that I come with my experience and knowledge of living and working in Treaty 1 territory, which is the original lands of the Anishinaabe, Inuit, Anishinaabe, Dakota Oyate, Dene, and Inuit, and on the national homeland of the Red River Métis. So just to give you an overview of what day-to-day happens in Manitoba, every day I walk into the CancerCare Manitoba building, which is in the heart of downtown Winnipeg. It is a unique place because the entire spectrum of cancer care and oncology research is housed within the exact same walls. The lower level floors houses the clinical spaces. Here, patients are receiving care, managing treatments, and dealing with the realities of their disease. But if you take the elevator up to the 4th through 7th floors, you enter the Research Institute. Up there are scientists and graduate students like me who are working on the bench, trying to deconvolute the complexities of a myriad of cancers. My perspective on this shifted when I took a literal elevator down from the 7th floor or the 6th floor down to the patient side, and I met one of my patients, Sandra Hodglow. I heard about Sandra's case. She was Manitoba's first CAR T-cell therapy recipient, but all I really heard about her story was the type of cancer that she had, the type of CAR T product that she was administered with. And for the second time now, she is cancer-free. Serendipitously, around the same time that she was receiving care, I was actually a first-year master's student in 2024, presenting on my project, which you've heard about now, which is hoping to improve the efficacy and safety of CAR T-cell therapy. What first connected our story, however, although this is not my favorite story to tell, was when the global news wanted to feature Sandra's story in the evening news, and they wanted some B-rolls of a scientist looking at cells, trying to run a fancy experiment. I'm sure some of you have had an experience of this before. And then this clip circulated on the internet. I've had some questions as to how I was involved in it. I actually wasn't. It was just a photo of a random scientist. It could have been anyone. But this really, what I take from this moment is that this might have sparked the patient engagement urge that I was craving. And it may not have occurred if I did not get a lot of questions from this news segment. Fortunately, I've had a very supportive supervisor, Dr. Yale Michaels, who wholeheartedly supported this urge. And just a year later, Sandra actually became one of our lab's first patient partners. She has kindly shared her lived experience with CAR T therapy, especially she's the first Manitoban to receive it, and is actively collaborating on our work to make this therapy safer. During one of our discussions, I was telling her that I was looking at one of the most common side effects of CAR T therapy, which is cytokine release syndrome, and how it can progress to neurotoxicity called ICANS. She told me that one of the side effects that she experienced was sounding similar, and she described it as this terror of not knowing herself when she woke up after this treatment. To me, this was really pivotal. It hit me that ultimately, we wanted the same thing out of this story. But for some reason, patients and scientists were speaking different languages, which often traps us into these dead ends. But once we actually get to sit down with them and discuss, we both can strategize a unique direction out. Another monumental piece to my story was when I participated in last year's Learning Institute. I was paired up with yet again another Sandra. I told both of them that my year quickly became a tale of two Sandras. Sandra Dudich here is a patient advocate for survivorship, and she's really a force to be reckoned with if you've ever interacted with her. I was very fortunate to be her academic scholar buddy last year. And while we were doing our pre-conference meetings, Cynthia Mitchell, another patient from Winnipeg, connected with us and proposed we all have brunch together downtown over some good, delicious food. And this is probably plugging that you should visit Winnipeg sometime. We believe that three Manitobans at the summit was a record for BioCanarex, and let alone those three coming from the Learning Institute. So from then on, Sandra and Cynthia have been my mentors and really dear friends. And we took that as a sign that we wanted to bring something back to Manitoba, especially for the cancer patients. I don't know if that's something that they wanted initially. I thought that I probably have just charmed them to sticking with me, even after the conference. But what we did is we met up at a lot of local cancer events to expand our network. We even met up last year at CCRC in Calgary. But sadly, earlier this month, after a strong fight against cholangiocarcinoma, with what she likes to call a rebellious hope, Cynthia passed away. And you've heard about this from the in memoriam yesterday. But Sandra and I and the rest of the community who has been fortunate enough to know Cynthia will continue her legacy and hope that we can honor her through the work that we do today. So the past year has really been transformative to me because of my invaluable mentors, which are my patient partners. To me, these two Sandras and really the rest of the Manitoban cancer community. And this brought me to a pause and thought to myself, if we can imagine if every graduate student can have a chance to have a patient partner guide them through their research. And better yet, what if we can have this at the core training of the next generation of scientists. So we wanted to bring this home to Manitoba. From what started as an abstract passion project from the three of us, it wasn't until last year's Imagine lecture by Shannon Snelling that really inspired us and illuminated what this could be a project for. And I'm very grateful to Shannon, who's in the crowd here today, and the Riddell Co-mentorship team in Calgary, who has inspired us. And our working group that started with 3 patient partners and 5 graduate students have really come together. And after a summer of hard work and pitching to CancerCare Manitoba, we launched Co-Pilot, which is the Co-mentorship of Patients, Investigators, Learners in Oncology Training program. So what this is really is a student and patient-led training program for graduate students and patient partners, which really aims to bridge the patient engagement in preclinical research, which has never really existed in our province. We subdivided this program into 3 major phases. The first one being the co-learning stage, where participants engage in a series of seminars and workshops that will lay down the foundation of their participation in the program. Our first one, again, a big thanks to Shannon and colleagues and Dr. Manoj Lalu, who provided an overview of the first principles of what patient engagement looks like in a preclinical lab environment. We then followed this up with a communication workshop that broke on the ice on the differences in the language that patients and researchers use on a daily basis, especially for the graduate students, and also how to harmonize these 2 different languages effectively. And lastly, since we are indeed a cancer center, we thought that doing a crash course in cancer biology would be helpful. And this year, this was delivered by Sadhna Sudhakar, who is actually a Learning Institute participant. I think there's only 2 Manitobans this year, and she's the other one. And this was also supplemented by other learning tools, like a very helpful slide deck that we were able to obtain from BioCanarex and Megan Cates, who's I think also in here in the crowd somewhere. This helped ensure that there's a common vocabulary that both patients and graduate students can use, and that we can establish this very early on and also to ease them into the core curriculum of this program, which is the co-mentorship phase. So here, over 6 months, each co-pilot group brainstormed and created a mini project. It's really a passion project, that's what we like to call it, that is under the cancer research umbrella. In this year's cohort, we have projects ranging from prevention, which one of the projects is an inquiry on the rise of colorectal cancer incidence in young adults, all the way to treatment. So there are novel therapies, immunotherapies and its side effects, and they've created a learning guide for patients that is very much accessible. And ultimately, there is also a survivorship aspect where we have a group that is focused on creating a trauma-informed psychosocial recovery pamphlet for cancer survivors in Manitoba. And finally, these projects are shared two ways. First, during the developmental stages of it, we host small group discussions that is open to the co-pilot cohort. It's basically like a peer review system for them. And the final projects will be presented as posters in a dedicated session at this year's CancerCare Manitoba Research Day, which is our province-wide event that brings together scientists, clinicians, patients, advocacy groups, and industry partners at CancerCare Manitoba. As I said, this is our first year, so we're still learning and we're actively seeking feedback from our participants. This is one of the testimonials from one of our patient partners, which really highlights their excitement and hopefulness in making an impact in research. And for our student partners, they acknowledge the new perspectives their patient partners bring, and we are also glad to see that shift in approach in wanting to have long-term relationships and partnerships in their home laboratories. So that's really what we wanted to bring here, is to help bridge that gap. Our top priorities for improving on next year's cohort is to include a peer support system for our patient partners. We receive feedback that it might be helpful for them to have a patient mentor that can help them navigate the partnership and their participation in the program. And then also we acknowledge that our cohort demographics this year does not necessarily reflect the Manitoban cancer population as a whole. So we have actively started early strategic partnerships and collaborations with our young adult cancer community as well as our Indigenous community through these local centers on ways to improve equity, access, and participation for co-pilots' future cohorts. Just so to wrap up, our first group of co-pilots come to a close this May, and I've been reflecting on my own training, and up on the screen here is a cockpit. Unfortunately, I tried to take a photo of a cockpit on my flight yesterday, but I didn't get a chance to. But up on the screen here, it's unironically in the namesake of our program, Co-Pilot. But what caught my eye on this image is the complexity of the navigation, which is exactly how I felt navigating cancer research a year ago. I was nervous. I'm still nervous. You see me sweating right now. I was overwhelmed, and I was flying entirely on the instruments that I got training from. And this is solely through an academic lens. My conventional training as a PhD student gave me this scientific precision. But when I have a co-pilot, a patient partner, to me, these are my two Sandras and the entire community of Manitoban cancer patients that would remind me to look beyond the bench, see the person, or simply look out the window. We can ensure that this scientific precision, the research that we're doing, actually finds its purpose in the clinic and ultimately to the lives of these patients. I would like to end here and thank you to the BioCanRx Network and for all of you for giving me this platform to share this journey with my co-pilots. And I also would like to acknowledge every single person on this slide and for their dedication and for their trust and sharing the same vision with me. And of course, to the CancerCare Manitoba and other funding agencies who supported our vision and made this project really possible. I think I have some time for questions. Yes.
Hi, Paul. Amazing work. What is one piece of advice that you could give to new graduate students who want to start engaging with patient partners in a meaningful way, but may not be cognizant of some of the challenges in sort of accessibility, energy, mentorship, the support that patient partners need from us in order to engage on an equal level?
I think it's a really good question, and it's a big one that has a lot of answers to it. But I think the very first thing that at least I started with was to really listen to the patient partners that I was able to engage with. They will tell you what they need, and at least the ones that I've encountered have been very cognizant of the fact that I have never done this before, and there might be patient partners out there that are also new to this types of programs or these types of initiatives. So I think being able to actively listen to each other, and really that's the goal of our program here, is to have everything in a 50% split between the graduate student and the patient partner.
Great. Thank you so much.
Yeah, thanks. I think that's it. Thank you.